Rushikesh Agarkar. He will be talking on successful management of pediatric Lyme injury. Dr. Rushikesh.
Hello. Good afternoon, everyone. Today I will be presenting a case on successful management of pediatric Lyme injury. Ocular chemical burns are an urgent ophthalmic emergency and represent 11.5 to 22.1% of eye injuries. Alkalis, most frequently being Lyme, constitute nearly 60% of all ocular chemical burns. In pediatric ocular chemical trauma, the commonest cause is bursting of tuna packets. Lyme, being an alkali, penetrates rapidly into the corneal stroma by saponifying membrane lipids and breaking down fatty acids. This causes destruction of proteoglycan ground substance and collagen fibrils, leading to opacification and tissue necrosis. So, a 7-year-old girl presented to the emergency department with right eye redness, pain, and watering since 3 days. The parents gave history of right eye accidental fall of Lyme while playing with tuna packet 3 days ago. History of consultation at local clinic where she was given primary treatment in form of ocular lavage was subsequently referred to a higher center for further management. So on examination, the visual acuity was PL present and PR was defective. Eyelid edema was present and limbal blanching from 9 to 3 o'clock with superior 1/3 deep stromal infiltration. Adjacent 2.5 to 3 mm of sclera was also showed infiltration with Dua's grade 4 ocular burns. B scan was within normal limits. So the patient was taken for urgent lamellar dissection with preserved donor corneoscleral rim for patch graft and amniotic membrane graft under general anesthesia. So here we can see the chalky white substance in superior 1/3 of the cornea and sclera was dissected revealing the underlying healthy Descemet's membrane and endothelium. Histopathology suggested dried up tissue with fibrotic stroma and calcification suggestive of Lyme deposits. Then double layered amniotic membrane grafting was done over the lamellar corneoscleral graft with fibrin glue. The present case was managed timely by debridement with followed by corneoscleral graft with AMG, which saved the tectonicity of the eye to enable future visual rehabilitation. On follow-up at 8 months, the child gave a vision of about 2 meters finger counting, and slit lamp examination showed vascularized corneoscleral graft with superior mild symblepharon, and there are chances of future visual rehabilitation. Clinical implications are use of techniques such as amniotic membrane grafts combined with tectonic grafts from preserved donor cornea provide a good emergency alternative. Chemical injuries, especially the Lyme injuries, are fairly common, commonly encountered in the emergency OPDs in India and necessitate a timely management which often can be site-saving. A proper primary management is critical and should be undertaken even in the peripheral centers, even in absence of an ophthalmologist. A lavage and proper debridement with timely treatment initiation can protect patients' prognosis even in need of referral. Examination of pediatric patients can be especially challenging owing to lack of cooperation. GA or sedation should be considered in these cases. These are the references. Thank you.
So nice present, Dr. Rushikesh. I just wanted to ask, what are the challenges when you see a pediatric case with a Lyme injury? What all you have to counsel the patient guardians regarding the same?
First, we should counsel the parents that the treatment is not just a one operation we do and it's over. It will prolong over. It can prolong over a year, and frequent follow-ups are needed for this. And more than 2 or 3 surgical interventions are needed if a proper visual outcome is expected.
So in pediatric cases, the main concern is the amblyopia. So you have to talk to the patient about the amblyopia also, because on most of the cases, these Lyme surgeries don't do really well. So you have to plan later on SLET also for the same. So multiple surgeries are involved. Second thing, the visual prognosis, you have to clearly explain to the patient, because most of the time these patient doesn't understand what the kind of injury they have gone through. So the amblyopia case you have to mention, and the proper counseling of the patient to be done. And did you do the corneal scraping in the case, because you didn't mention anything about the corneal scraping, about the infiltrate?
Corneal actually, sir, the lime particles which were embedded, a whole layer came out intact of lime particles.
So you didn't send the sample for the scraping. So you mentioned that there was an infiltrate, stromal infiltrate. Did you send the sample for the same?
We sent it for histopathological examination.
So you didn't send for the corneals this culture?
No, sir, not for culture.
So like how did you differentiate then? It was the corneal stromal infiltrate only, or it was the lime particle which was there, embedded there? So initially, if you plan to do any kind of surgery in these cases, the chances of failure very high. So what we have to do, we have to remove whatever it is there left behind, and we have to start the treatment properly. We have to start the steroids according to the phase of the injury, and if at all we can prevent to do any kind of surgical intervention in case of in case of scleral patch graft or like keratoplasty, because these graft doesn't do well because of conjunctivation of the cornea. Okay, so I saw your picture, there was a conjunctivation of the cornea, but the sutures were still there. If you see the your slit lamp photo, so the corneal suture you have taken scleral patch graft, your sutures were still there.
Yes.
So in cases of Lyme injury, there is a chronic inflammation which is going on. So you have to remove any kind of inflammatory things like sutures or anything like that, so that there should be a minimum inflammation. There is a quiet period of that, so that you can plan ahead some surgeries according to that. So you have to plan something for the visual vision also. So you have to plan like slat or something, clat, whatever you want. So other eye is fine, so you can plan slat in this case. So in that case, you have to remove any kind of inflammatory things which are there in the eye, and I think rest of the things are okay. You guys did a very good job. So Dr. Gupta, you want to ask anything?
Is there any role of high doses of vitamin C?
Yes, sir. Vitamin C can be given so that healing process can be improved if we give vitamin C oral, and eye drops can also be given.
Will you like to comment?
So basically what vitamin C is basically ascorbic acid. So there is a high quantity of ascorbic acid which is present in the aqueous humor. So whenever there is a chemical injury, the levels of ascorbic acid goes down, and ascorbic acid is very important for the synthesis of collagen. So in the healing phase, you require a lot of ascorbic acid for the same. So the role of ascorbic acid is in the synthesis of collagen, which will help in the healing in later phase. Thank you. Thank you for a nice presentation, Dr. Rushikesh.